Today is World AIDS Day, an opportunity for people to unite and show support in the fight against HIV and commemorate those who have died from an AIDS-related illness. Manisa Dendabalan joins us live. And Manisa, it's one of the most destructive pandemics in history.
That's right, Nicole. I'm at a World AIDS Day vigil in Hamilton, Ontario, one of many events taking place worldwide. The virus was identified in 1984, and since then, nearly 40 million people have died of HIV or AIDS-related illness.
Acquired immunodeficiency syndrome, also known as AIDS, is caused by HIV, human immunodeficiency virus.
HIV is a type of virus that when it infects you, it can severely diminish your immune system, making it difficult for you to fight off other diseases. And it's a challenge because there's no real cure for it. So once you have it, you're kind of dealing with it for the rest of your life. And that's one of the major challenges that we have.
Even though we don't have a cure yet, as long as somebody is keeping up with their treatment, then they can manage it perfectly well.
Global organizations are sounding the alarm about the epidemic.
Currently, we are not on track to end AIDS by 2030, and the reason is inequalities. But there is good news. By equalizing, we can end AIDS. Equalize access to rights, equalize access to services, equalize access to resources, equalize access to the best science and medicine.
The World Health Organization recently reported a slowing in the decline of new HIV cases, ever since countries focused their limited healthcare systems on COVID-19. In a statement today, Prime Minister Justin Trudeau said the first case of AIDS in Canada was reported in 1982, and 40 years later, there are nearly 63,000 people living with this disease in our country. Despite the progress Canada has made in recent years, there are many people in Canada who are not currently diagnosed or being treated. Sean Hosein from Katy says there's been huge advancements in treatment and prevention over the years, but the stigma around it still exists.
It's not as bad as it was in, say, the 1980s when AIDS and HIV infection were almost invariably fatal. What's more, treatment is so effective that people do not pass on the infection when their virus is suppressed.
Over the years, many celebrities have taken a step to break the stigma, including Princess Diana in April 1987, near the height of the AIDS epidemic. When there was a lot of fear, she opened UK's first specialist HIV/AIDS unit at the Middlesex Hospital and met with the patients. In 1993, at an AIDS conference, she pleaded for compassion.
All too soon, we will all know someone with AIDS. A brother, sister, mother, father, son or daughter could be next. How will we treat them? With compassion and care, or fear and rejection?
Another challenge today is the fact that many don't know when they have HIV.
About 10% of people who have HIV in Canada are not aware of their infection status.